The special care provided at Benefis Peace Hospice Residential Facility is compassionate, supportive, and focused on comfort and quality of life. This home away from home for terminally ill hospice patients opened in 2002 and was made possible by anonymous gifts of $7.1 million to Benefis Health System Foundation. The Hospice Residential Facility is staffed 24 hours a day with providers who are experts in terminal care, including effective pain management techniques. Along with tending to physical needs, these caregivers also address psychological, emotional, and spiritual issues that surround the dying process. The facility allows families and friends to focus on time together with their loved one during the last days of their lives.
And we told Mom that's what we were doing. We're moving you into your own apartment. And she just, she just sits up so proud in that room and is so happy. And my brothers just felt such a relief when we came in here and they realized that this was really going to be such a wonderful gift that we could give to Mom for all the things she's done for us for all the years, that we could give her a little bit of just a beautiful surrounding and caring people. The nurses care so much about her.
They treat us like family here when we walk in. They always let us know how Mom's done, and it has just been, it's a blessing.
It's a wonderful place.
We feel very blessed as a family that we got an opportunity to share hospice experience.
The Hospice Residential Facility has 12 large private rooms that include a hospital bed, a sofa bed for family members, handicap-accessible shower, closet, sink, microwave, refrigerator, and TV, as well as a small patio area outside. There's also a community kitchen and dining room for patients and families to enjoy meals together, as well as warm sunrooms and cozy sitting areas. A sunny atrium is located in the center of the building and includes seating for patients and their families to enjoy the bird aviary and garden.
Patients and families are so grateful because of the large private rooms. They're able to gather and have that time at end of life with their loved one.
Once we arrived here, we were freed from that really overwhelming responsibility for Joel's comfort and care, and handing that over was a huge gift to us because we could go back to being his family and not having to be responsible for his care and not having to worry about that. We could let go of the worry and just be a family.
I really never knew about hospice until Dad needed hospice. And little did we know that there was this wonderful facility here, or this wonderful caring place here where he could spend his last 6 weeks of his life. The folks at hospice invited us to care for Dad as much as we wanted to care for Dad. We brought a crock pot in here almost daily. My sister and I took turns fixing suppers, and Allie set the table and we all gathered around the table.
The Benefis Peace Hospice Residential Facility has provided its special care to people from throughout north central Montana. Until 2009, the Hospice Residential Facility was able to welcome any terminally ill patient. Sadly, that is no longer the case. Beginning in May 2009, there has been a waiting list. Patients and families who have experienced what Peace Hospice Residential Care offers during this crucial time understand the tragedy of this situation.
It's heartbreaking, knowing that if we had more room, that we would be able to bring them here and give them the gifts and the skills of our team. That it's possible to have hospice care in other environments, but I believe they get the full intensity of what we can do, the comfort and support.
The Benefis Peace Hospice Residential Expansion Campaign will make it possible to add on new 4-room pods to the existing east and west wings, bringing the facility to a total of 20 private rooms. It is our hope that this expansion will eliminate the waiting list, ensuring that all who desire this comforting, special care can be served.
The Peace Hospice of Montana and the services it provides, I'm very proud of it. I think it is an incredible service to our community, to the patients who have used it, to the staff that are tireless and do such wonderful things for the families that they serve. And I just like to see everybody who wanted to be able to use the services be able to do that.
The Peace Hospice Residential Facility expansion is dependent on philanthropy. Benefis Health System Foundation needs to raise a substantial amount of funding for the expansion and for the endowment to support the operations of the facility.
The inpatient facility is not a money-making proposition. It is very expensive to run the inpatient facility, plus the way that it's designed to be a home-like atmosphere. The level of care that's provided here also contributes to the cost of care here. And plus, we also serve patients who don't have an ability to pay. So because of that, there's where the need comes in for philanthropy.
This expansion will give all of our family members and friends the opportunity to choose the Peace Hospice Residential Facility if this is where they'd wish to spend their final days.
But it only has 12 beds, and that's the scariest part about it, is if they run out of room or if they're full, what options do you have?
I really applaud Hospice and the Benefis Foundation for being forward-looking. The next couple of decades, there's going to be a tremendous need for more beds.
I would say, please, if you can donate to a cause that actually helps not only the individual but the family and those involved with that person, this is the one thing that would really, really, really help everybody involved.
We need your help to make this expansion a reality. Please contact Benefis Health System Foundation for more information on how to contribute to this important cause that will benefit many people now and far into the future.